What is influenza? It's a serious viral illness that can affect anybody, and it can cause anything from no symptoms to cold-like symptoms to severe respiratory illness, pneumonia, respiratory distress, and death. People don't understand that influenza can be a very serious illness and a life-threatening illness, and it's always better to get vaccinated than to go through the natural disease.
Plus, when you get the natural disease, you're more likely to spread the virus to others as well that may not have been vaccinated.
The ones that are most susceptible to the flu are children younger than 5 years and those older than 65 years. So adults over the age of 65 years have a lowered response to the vaccine and are recommended to get the higher dose of the vaccine or the adjuvant vaccine. But if that is not available, then they can get the regular dose of the flu vaccine. The immunocompromised people should use a vaccine that's specific for their situation, but they should not receive the live attenuated vaccine. All pregnant women at every stage of their pregnancy and those trying to conceive should get the flu shot. So it's not common for people to get sick from the flu shot, but there are a lot of viruses that are circulating at the same time that can cause a similar illness, which people confuse for the flu. And the only way to find out if you got the flu or not is to get tested for it.
You may get some local reactions to the vaccination as well, and it may muscle aches, pains, and whatnot, but it really is not. It's not the flu, and you can't get the flu from the flu shot.
What can people do to prevent themselves from getting the flu? The most important step is vaccination, but there are simple things like hand washing, cough etiquette, practicing social distancing, staying home when you're sick, and mask wearing that can protect you from getting the flu or from giving other people the flu.
So as a data-driven organization and lessons learned from COVID-19 and last year influenza season, we saw very few cases of influenza last year, not only due to vaccination, which was very important, but also mask wearing, hand washing, and social distancing. Our ask is that you really seriously consider getting the flu shot this year again to help not only protect yourself, but those around you and the patients we care for.
It's absolutely important to get both the COVID-19 vaccines as well as the flu vaccine because they're both different illnesses, and vaccination against one doesn't necessarily protect against the other. Don't wait to vaccinate. I think it's very important for you to protect yourself, your family members, your co-workers, and most importantly, the patients that we care for every day, the most vulnerable section of our population.
So while we strongly urge caregivers, all caregivers, to get vaccinated, we understand there may be circumstances where they either can't get it or reasons why, and with those, it is required to have some written reason why you cannot accept the influenza vaccination.
Because we work in the healthcare system day in and day out, and we are dealing with sick people that depend upon us to keep them safe, and therefore I think it's our collective responsibility to get vaccinated.
And we as caregivers must lead by example, especially when we have preventative means to help prevent disease, especially for those vulnerable populations that we care for.